This is Dr. David Stoker, board-certified plastic surgeon in Marina del Rey, here to talk to you about eyelid surgery, otherwise known as blepharoplasty. Eyelid surgery may be performed in the upper or lower eyelids. It's one of the most commonly performed procedures. As you can tell, I'm looking you in the eye right through the camera right here. We're looking each other in the eye, and that's common. The eyes are very important for determining expressions, for the subconscious, determining your age. It's significant for people's work and how they're perceived by others. You can look tired before you actually are, and just overall you can make big improvements in this area. Fortunately, you can also have a quick recovery from these procedures. It's a relatively small area of the body that heals quickly, can be high impact with minimal downtime. It's also the area of the face that typically first begins to show signs of aging. So for many patients, both men and women, it's the first area in the face that they'll approach me for facial rejuvenation surgery. On the upper eyelids, typically remove excess skin, a little tiny strip of muscle, and in some patients, a little bit of fat. It's important not to remove too much fat, and that's got to be individualized because it can actually make somebody look older if it's done excessively. On the lower eyelids, there can frequently be dark bags under here or tear troughs, which most often we'll treat by removing fat in a scarless technique where we remove it from behind the eyelid by teasing out the fat that causes these bags underneath here. For the majority of these patients, they can also benefit from some type of fractional laser resurfacing. That's good at treating the fine little lines and crepiness that we get in the crow's feet or the crepiness underneath the eyes. It can be done at the same time as these eyelid surgeries. The last thing for eyelid surgery we're going to want to consider is doing a little bit of filler. I consider that to be icing on the cake, laying in a little bit of filler in the tear trough area here on each side where there can sometimes appear to be a darker circle, can be very effective at getting the last bit of aging out of those eyelids. When a little bit is performed in several different areas around the eyes, it can be very impactful in patients and rejuvenating them, making them look like they did years ago in a very natural way that has a high degree of happiness and patient satisfaction. Obviously, these procedures need to be individualized. I invite you to browse the huge photo gallery of my results on my website to see what's possible in my hands. If you're interested in a consultation, I'd be happy to meet you here. This is Dr. David Stoker, board-certified plastic surgeon, speaking to you from Marina del Rey, California.